Hello. The title of my presentation today is Methylation Profiling Accurately Predicts the Risk of Recurrence in Meningiomas when compared with current WHO grading criteria. Before I begin, I want to thank the CGC Annual Meeting Committee to give me this opportunity to present my work. So let's get to it now. I have nothing to disclose. Here, dealing with meningiomas, the subject of cancer type of the study is meningiomas, and meningiomas are the most common CNS tumors in adults. Meningioma patient management is rely lots on grade 1. Patients are used, the guidelines that will be surveillance and serial imaged. For grade 2 and 3, adjuvant therapy with radiation therapy after resection is the norm. And grade is usually determined by morphology and proliferation with methodic count. As you can see, what really happens, as you can see, grade it's really important for the management of meningioma patients, and sometimes morphology, it's not that accurate, sometimes a little bit subjective. So that's why we are interested in looking at meningioma grading. Here in Northwestern, we do a lot of methylation profiling, and we want to answer the question if methylation can be actually used to actually determine meningioma grade. Our data set here comprises of 207 meningiomas. They were in-house diagnosed and treated. Those samples were profiled. They had a methylation profile using genome-wide DNA methylation using epic arrays V1 or V2, Illumina epic arrays. Of those 207 meningiomas, 93 were grade 1, 92 were grade 3, and 51 were grade 93 were grade 1, 92 were grade 2, and 15 were grade 3. Sorry. Once we got this data, the first step was actually to look at the structure of the data. To do that, we opt to use an unsupervised clustering method, which doesn't require any prior knowledge of the data. So we got the beta values, and we performed a k-means clustering for that data set. Here we use a k equals 3. One might ask why k is equal to 3. Data is not shown, but we did a elbow method analysis to determine what would be the optimal number of clusters, and actually 3 is that number. So as you can see, we have 3 clusters here, green, blue, and a red cluster. This is a PCA plot. We're plotting the first 2 dimensions to the PCA components. And as you can see, we can see 3 distinct clusters with 3 distinct centroids. Although there's some overlap between them, this cluster is pretty robust and fairly distinct among each other. So the next question was actually to see if there's any correspondence between those 3 clusters that we found with WHO grading, the diagnosis. So as you can see, we have 3 clusters, a blue methylation cluster, a red methylation cluster, and a black methylation cluster in this image. This is not using PCA, this is using t-SNE. There's a little bit better separation on t-SNE, but it's different visualization method. But as we can see here, that cluster 1, which is blue, is enriched for WHO grade 1 samples. WHO grade, the cluster 2 has a lot of methylation, WHO 2 methylation, and WHO grade 3 is actually enriched for methylation for those samples. So you can definitely look at this graph and you can see those dots corresponding. Oh no, there's some overlap. It's not perfect clean, but overall we see that trend, which is very exciting. So then we wanted to say, okay, so we see that this corresponds between WHO and grading, and methylation clusters, but what actually that does it mean for patient management and actually survival of the patient. So we plot two graphs here, two Kaplan-Meier curves, one of WHO grading and one with k-means, the k-means clusters. As you can see, the WHO grading, we have like three clusters, obviously, three curves, red curve for grade 1, green curve for grade 2, and a blue curve for grade 3. As you can see, we see a clear separation between 1, 2, and 3. 2 and 3, there's some overlap between those. Statistically, they are different. There's a p-value of 0.06. So when we look at the k-means cluster grading, the Kaplan-Meier for progression-free survival of the k-means clustering, we see actually better separation. As you can see, cluster 1, which is red, which is enriched for WHO grade 1 samples. Cluster 2, which is green, enriched for grade 2 methylations, WHO grade 2 samples. And a cluster 3, which is a blue cluster, blue line, which is enriched for WHO grade 3 samples. And you can see a clear separation, a better separation than if you look at WHO grading Kaplan-Meier curve, showing that methylation, indicating that methylation can actually distinguish between those clusters actually meaningful when they have a component regarding to survival in those patients. The p-value for the k-means grading Kaplan-Meier is actually lower. Now, next, we look at WHO grade 1 and see WHO grade 1 can be stratified using methylation. So what we did is we get all WHO grade 1 methylation WHO grade 1 samples that were deemed WHO grade 1 at the time of diagnosis. And we look at the corresponding clusters. So we separate them in three clusters. WHO grade 1 samples that actually are shown in cluster 1, WHO grade 1 samples that are in cluster 2, and WHO grade 1 samples that are on cluster 3. As you can see, when we plot the survival curve, we see very distinct survival curves, similar to what we see before. So this can be indicative that those samples that were deemed WHO grade 1 actually are not grade 1, or right, they are actually grade 2 or 3, or they're different, they behave differently than what we expect to a grade 1 sample. And this is what this curve shows. And as we can see, we have a very strong p-value to show the distinction between those survival samples, showing that methylation can actually be able to stratify WHO grade 1 samples according to survival. Which is really exciting. So in terms of conclusions, we show that methylation can separate meningiomas in three distinct clusters when we use unsupervised clustering. We know that groups derived from methylation have a high correlation to WHO grade, as I have shown before. And methylation groups can better distinguish between grade 2 and 3. We see a clear separation between them. And we also show that grade 1, that cluster with 2 or 3, has worse progression-free survival. I also want to say that we need further studies on this, and this was doing prospectively. We probably want to gather more data and do more analysis on this, and also try to understand if there is any molecular mechanism or differentiation between the two different, biologically we haven't looked at that, but look at the pathways, see if there is any difference, what methylation probes and like genes are differently methylated between those two, specifically WHO grade 1 samples, why they were clustered at grade 1 at diagnosis, but they actually behave like grade 3 or 2, what's driving those mechanisms. So this is in a future study, we are working on that. To conclude, I also want to acknowledge all the collaborators in this group. A lot of the work that I showed here was done by Dr. Drew Duckett and my group. The person that actually came up with this study is Dr. Marina Sukhanova. So, and also all the collaborations in the group, people that contribute that, Dr. Puya, Shinyan, Erica, Lauren, Dr. Jennings, Dr. Castellani, and Dr. Brett. So thank you very much. And I will take any questions now. Thank you very much.